Welcome to this video on sequestration crisis in pediatric nursing and hematology, presented by Mr. Nagesh Sir from ND Nursing Coaching. Sequestration crisis is a major complication of sickle cell disease, an autosomal recessive disorder where normal hemoglobin is replaced by sickle hemoglobin. Sickle cells only live 10 to 20 days, causing chronic anemia, which is acutely worsened during a crisis. Sequestration crisis is an acute, life-threatening condition where blood pools in the spleen because sickled cells block the veins. This results in massive splenic enlargement and decreased circulating blood volume, leading to hypovolemic shock and cardiovascular collapse. The most dangerous period for sequestration crisis is between 6 months and 5 years of age. Before 6 months, the child is protected by fetal hemoglobin, and after 5 to 6 years, the spleen typically undergoes autosplenectomy, which makes the crisis rare in adults. To quickly review, the most common age group for splenic sequestration crisis is 6 months to 5 years. Early signs include irritability, lethargy, pallor, and abdominal pain in the left upper quadrant. Critical signs involve massive splenomegaly, tachycardia, hypotension, and hypovolemic shock. Remember, hypotension is a late sign of shock in pediatrics. Diagnostic evaluation reveals low hemoglobin, a low platelet count, and a high reticulocyte count. The high reticulocyte count is key, indicating a healthy bone marrow attempting to compensate for the sudden anemia. It is important to differentiate sequestration crisis from aplastic crisis. Sequestration involves an enlarged, massive spleen and high reticulocytes, whereas aplastic crisis involves a normal spleen and decreased reticulocytes. The primary cause of death in sequestration crisis is hypovolemic shock. Emergency management follows the VIP protocol. Priority 1 is volume replacement using IV fluids like isotonic crystalloids and packed RBC transfusions. Priority 2 is administering oxygen to prevent further sickling. Remember to transfuse blood slowly to avoid hyperviscosity. Surgical management involves a splenectomy, which is indicated for recurrent episodes of sequestration crisis. This procedure carries the major risk of overwhelming post-splenectomy infection, or OPSI. Post-splenectomy care focuses on protecting the child from encapsulated bacteria. This includes antibiotic prophylaxis, typically oral penicillin V daily, and necessary vaccinations like pneumococcal and meningococcal. Let's practice an exam question. A 3-year-old with sickle cell anemia, a palpable spleen, HB5, BP 70/40, and a reticulocyte count of 15% most likely has splenic sequestration crisis. The combination of an enlarged spleen, severe anemia, and high reticulocytes is classic for this diagnosis. Another question. Following a splenectomy, a child is at the highest risk for infection by encapsulated bacteria. This is because the spleen filters these organisms, and its removal requires strict vaccination and prophylactic antibiotics. To summarize, sequestration crisis involves the trapping of blood in the spleen, resulting in hypovolemic shock. It affects children between 6 months and 5 years, is diagnosed by high reticulocytes, and treated with fluids, blood, and often a splenectomy. Thank you for watching. All the best for your exams. You can contact Mr. Nagesh Sir for notes and test series.